I think we can probably get started.
Yeah, we were ready.
I would go for it. I mean, it's supposed to start at 2, so my feeling is it'd be lovely to get going.
All right, let's go for it. So hi everyone, my name's Louise. I'm a voice therapist working at Charing Cross Hospital and also over at St Mary's. And I'm also on the call with my colleague Andrea, who will be introducing herself a little bit later. So thank you so much for inviting us both to come and talk to you today about your voice in an era of telehealth and masks. Over the next hour or so, we hope to be able to give you some advice and some tips about how to look after your voice. We want to make this session really practical, so we're going to be giving you some time throughout to try out some voice exercises. And we hope to have a little bit of time at the end to answer any questions, so feel free to pop those in the chat function and we will have a look at those at the end. Just some housekeeping, I'm sure you're all muted, but if not, if you could just pop yourself on mute, that would be super. All right, we'll make a start. So over the next hour or so, we hope to talk a little bit about how we've changed our voice use in the current months. We're going to think a little bit about the anatomy of the voice and also think about some signs and symptoms of vocal abuse and also misuse. We'll talk to you about some vocal hygiene advice. We'll think about how you can really protect your voice. And as I mentioned, we'll have a practical element where you'll be able to learn some voice exercises. We'll touch a little bit on your voice and your mask. And finally, we'll give you some advice on how you can screen your patients for any voice, airway or swallowing issues. So we just thought it would be a really good place to start to think about how we have actually changed our voice use in the last few months. So certainly in an outpatient setting, we're obviously not seeing as many patients face to face, and we're really relying on video and phone calls. Certainly within the inpatient setting, we're now needing to wear masks when we see our patients, which is removing a lot of that visual information when we're communicating. Not only are we using video and telephone calls to communicate with our patients and our colleagues, but we're also relying on those platforms to talk with our family and friends. So we're constantly using these different ways to use our voice. And then finally, we know that this period has been incredibly stressful, and stress has a huge impact on our voice. So as you can see, there's lots of ways that we're using our voice differently, and we just thought this was a really good time to talk to you about how to keep your voice nice and healthy and how to look after it. So we thought just to begin with, we touch a little bit on your anatomy. So the lungs, the larynx and the mouth help you to produce your voice. And inside your larynx are your vocal cords, and those contain a ligament and a muscle, and they're covered by a mucous membrane. Each of your vocal cords is about half the size of your thumbnail, very small. So in order to produce your voice, you breathe air into your lungs, then you force the air back up your trachea, and that passes through your larynx. And as the air is passing through your larynx, that's what makes your vocal cords vibrate. And it's that vibration which makes a sound, and that is the source of your voice. That sound then travels up through your throat, your nose and your mouth, where it's articulated into words by the movement of your lips, your teeth, and your tongue. Now, if you just take a look at the image on the right-hand side, you can see in the center of the picture that the vocal cords are in an open position. And that's how the vocal cords are sitting when you're breathing, which is allowing air into your lungs and then allowing you to exhale air into your mouth through your nose. On the image on the left, you can see that the vocal cords are in a closed position, and that's how they are when you're coughing temporarily. And then, as I mentioned, the vocal cords are vibrating when you're producing a sound. So we thought the best way to try and show you the movement of the vocal cords would be to show you a stroboscopy exam. So this is an examination which is completed by a speech therapist and/or ENT, in which a strobe light is combined with a rigid or a flexible laryngoscopy, which allows examination of the vocal cord vibration and also the vocal cord closure. And this type of examination is used in the diagnosis of voice disorders. So I'll just start playing this video for you now. And you'll see the scope goes into the patient's mouth. We'll have a better look at So if I just pause it there, you can see the two white areas, which are the vocal cords. The surrounding muscles are the false vocal cords, and then surrounding that is the pharyngeal muscles. And as this patient starts to voice, you'll see that the vocal cords are vibrating. Should also say that you might notice some little bumps on this patient's vocal cords. That's because she has a diagnosis. Normally we'd expect the vocal cords to be nice and smooth. You might have also seen that when the patient was producing a low note, the vocal cords were short and fat. And then as the patient was producing a high note, the vocal cords were stretching into a long and thin position. Just play the rest of the video. So I'm going to pass over to Andrea now, who's going to talk to you about normal vocal cord movement versus a strained or tense vocal cord movement.
So yeah, we thought it would be important to show you guys what your anatomy looks like if you are straining, which it's easy to strain when you are doing virtual therapy. So we thought maybe giving you the image of what's happening in your throat when you strain will help you understand why we don't want you to do it, other than the fact that it bothers you or it hurts your voice or is causing you pain while you're trying to work with your patients. So the picture on the left that has the yes, that is a beautiful depiction of somebody with basically perfect vocal cords. You can tell that the actual vocal cords are nice, white, and shiny. There's no edema or erythema. And the surrounding false vocal folds are at rest. They're not being engaged, which is good. It means that this person is relying on her breath to pass through the vocal cords and vibrate. And you can see she has no gap between her vocal cords. So it just goes to show that this person, whoever she is, probably uses her voice in a really nice, healthy way. Whereas the picture on the right that says no, you can see that those false vocal cords are engaged so much so that you can almost not see the full length of the vocal cords themselves. So you can't see quite as much white on the picture that says no. And you can also see that this person has a gap between their vocal cords. So a gap kind of at the top and a gap in the middle, which means extra air is escaping. When your false vocal folds are engaged that much, you're not really allowing the air to just pass through and set them into vibration. Rather, you're pushing them together so hard that it's almost like you're holding your breath. So like right now, if I'm talking to you and I'm basically like holding my breath while I'm talking to you because I'm trying so hard to be understood so you can hear me on the other end. But what's actually happening is what you see in that picture on the right. And other than the fact that using that type of voice doesn't give you the result that you want. So other than that major factor, the second major factor is that it can cause you long-term issues if you're using that voice frequently, or 5 days a week if you're seeing patients virtually that much. So just bear that in mind when you feel yourself straining or you hear that your voice isn't doing what you wanted to do. Have that mental note of what's actually going on physiologically. I think we can go to the next slide, Louise. So let's talk about what those signs are. If you're overusing your voice or misusing your voice, how can you pick up on whether or not you're doing that? So one big factor is the sound of your voice changes. So you just don't really sound like yourself, or maybe a colleague or a family member is like, hey, what's going on with your voice? That would be an indicator that you're probably doing something to kind of tire your voice out or overuse your voice. Not being able to access certain parts of your range. So maybe your voice is a little bit deeper than it's used to being and you can't seem to change that. That would be an indicator. Your voice feels tired, your voice is giving out, you don't have the stamina you used to have, maybe your throat feels quite sore, or maybe it feels really tight, maybe your throat feels really dry. Any of those symptoms would be an indicator that you need to make some sort of change so that way you can use your best voice possible. If you were just doing a one-off webinar or a one-off virtual therapy appointment, you probably wouldn't really have to worry about your voice. But being that a lot of us are doing this every day now and it's becoming a routine for you, it is something that you now have to start thinking about and kind of incorporating into your routine to think about your voice and take care of your voice. So make sure you pay attention for these signs. I'll hand it over to you, Louise.
So as Andrea has touched on, it's really, really important to keep your larynx nice and healthy in order to optimize your voice. So one of the best things you can do is just to make sure you're really, really well hydrated. And this is because the vocal cords need to be lubricated because of the heat and friction that's caused when they are vibrating. So an average healthy person should ideally be drinking about 2 liters of water or fluid per day. Another way that you can hydrate the vocal cords is by doing some steam inhalation. So this might involve you boiling the kettle and having a mug of hot water in between your patients and just doing some gentle steam inhalation. Some people might find it useful to do some steam inhalation first thing in the morning before they head into work, or if your voice is feeling particularly tired of an evening, again, 5 minutes of steam inhalation can really lubricate everything in your throat that might be feeling a little bit tired. There are some things that can make voice issues worse, and actually caffeine and alcohol can be incredibly drying for the throat. So just be really mindful of how much caffeine and alcohol you're having. Smoking is something else that can really irritate the vocal tract. So this can sometimes make the vocal cords swell and also become inflamed. So yeah, it's important to just think about smoking as well. Try to avoid any throat clearing. This is something that can become really habitual, but actually when you're clearing your throat, you're actually banging your vocal cords together, which can be quite damaging. Rather than clearing your throat, it's much, much better to have a large sip of water and try and swallow really, really hard and try and clear anything that you're feeling in your throat. If drinking fluid doesn't help, then you're much better off having a strong cough because the vocal cords will just be touching temporarily. It's also, reflux can impact your voice because acid reflux can come back up and irritate the larynx. So just be aware of reflux symptoms and discuss that with your GP or your pharmacist if you're concerned. Tension in your shoulders, back and neck can really generalize and impact your larynx as well. So it's important to keep everything nice and relaxed. It can be useful just to do some head and neck stretches, again, in between your patients. So just rolling your head around or rolling your shoulders back, shoulders forward, doing some nice stretches with your arm to try and reduce any tension in these bigger muscles that might be impacting these smaller muscles in your larynx. Over to you, Andrea. I'm not sure if I can hear you, Andrea. It might just be me.
Sorry, I had it on mute. So one practical tip, make sure you're not on mute when you're using virtual therapy. So here's some practical tips just to give you to think about while you're doing virtual therapy. So remembering that your voice is a limited resource. So it's a muscle group just like any other muscle group. You would never expect your body to be able to withstand jogging 7 hours a day, 5 days a week. You would never expect your body to be able to do that. So don't expect your voice to be able to withstand that either. One way to take care of yourself is to take vocal naps. So between patients, make sure that maybe you've set aside 5 to 10 minutes, maybe even 15 minutes, maybe while you're writing up a note, just not to say anything, not to call a colleague, not to call someone from home, not to discuss anything with anyone, and just to allow your voice to have that rest to reset for your next video call. I don't know if anyone here has these capabilities, or whether some of you are sometimes at home and do have this capability, but sometimes using a mic or a headset can be really useful, mainly because that microphone is a really nice visual cue for you that you don't have to strain, you don't have to try and project, you don't have to be louder than usual to be heard. And sometimes that's nice. When you're here at work, you probably don't have a headset. And in that case, I would say use a sticky note reminder. So put something right next to your camera, a little sticky note on the left or right that just says something like, don't shout, take care of your voice, something that just reminds you when you're thinking about your patient, really trying to work with your patient, oh yeah, I need to take care of me too. It's so easy to immediately just start talking really loud whenever you're working with a patient, especially when you're trying to show them an exercise. You have so much to get done and they're not hearing you. It's really easy just to rise at that level. Our subconscious does it when we're on the telephone and when we are doing virtual therapy through video call. It's just something our body naturally does to compensate for the fact that we're not right in front of this person. So having that little reminder can be really useful. Remembering that speaking should just feel really easy. So even me now giving this webinar, I can feel myself projecting more than I need to, or trying to compete with what's going on outside. And it should just come really naturally and really easy. So Louise, you can go to the next slide. So plan your day thinking about your voice, among all the other things I know you have to think about. Plan it so that way you have managed your expectations about how many patients you can see that day. Maybe it's not the same number as you usually can. Or maybe you can just expect that you're not going to be able to do in one session what you could do in a session that's face-to-face, and just be okay with that. The main thing that you need to do when using virtual therapy, either on the phone or video, is to slow down your speech. If your patient's having trouble understanding you, rather than getting louder and trying to say, can you hear me now? Is that okay? Can you hear me? Instead of doing that, ask your patient, can you turn up the volume? And if they're still having trouble, slow down your speech even more. Because oftentimes it's actually the internet connection that's the biggest issue, rather than just whether or not you're being heard, whether your volume is too low or too high. It's more about the internet connection. So try and just take everything a bit slower. Also, when we speak slower, it allows our brain to take a breath before we start speaking. So rather than talking and talking so fast, you're holding your breath, you're not taking those extra breaths between, you start relying on those false vocal folds that really are only supposed to engage when we bear down or cough or hold our breath. You're engaging those false vocal folds when you really shouldn't be. And you're also engaging all these extrinsic muscles of the larynx that can be causing a lot of tension, a lot of this. So we really want to try and reduce that. And by slowing down the pace, you allow your brain to take that breath in. Okay, for our next exercise, we are going to do, and you can just make it really nice and slow. I call it a cost-efficient voice. Using a nice, easy, slow, on the breath voice is going to allow you to get through the entire day without any pain, soreness, tightness, or issues with your throat. Lastly, I highly recommend doing some exercises and, as Louise said, and stretching between your patients. So making sure, again, that you leave that little bit of time, however much that time is, whatever you can manage in your day. Even for those of you who maybe are seeing inpatients and you're wearing a mask and you're having to project more than usual, put that time aside to do a quick little stretch and exercise to reset the voice. So that way, when you go to see your next patient, you're not walking in there with all this tension that you're only going to build upon. Rather that you reset, get in a better place, and then go forward. Over to you, Louise.
So next we wanted just to move on to some really practical elements, and we thought we'd start with breathing. As we've mentioned previously, that the breath is vital for your voice, and it's the breath which sets the vocal cords in motion and sets them vibrating. So essentially, if you have poor breath support, this is when, as Andrea has mentioned, you'll start involving that tension, and that's what can lead to possible voice issues. So the best way to support your voice is to use diaphragmatic breath support. And that shifts the focus of your breathing to the lower part of your body, which then reduces the amount of effort in your upper chest, shoulders, and larynx. So physios, I'm sure you are experts in diaphragmatic breath support, but we thought we'd just run through some exercises to really practice using that with your voice. So I'm just going to stand up for the next part, and I hope that you will also give this a try at the same time. So I'm going to stand up, and I'm going to pop one hand on my chest and one hand on my tummy. And I'm going to take a really deep breath into my tummy, and I will notice that the hand on my tummy should expand. So hopefully you can see. I'm going to take a breath in and then exhale. I'm going to do that a couple of times, and I hope you'll do it with me. So once you feel like you've got that technique and you're breathing nicely into the hand on your stomach, we can play around with some sounds. So I want you to take a really deep breath in, and then on the out breath, try and produce a sound for as long as you possibly can. If you're running out of breath, don't strain, don't push the S to the end of your breath. You want to stop just before so it's nice and comfortable. So I'll give you a sec just to practice that one. Great. So once you feel like you're able to sustain that for as long as you possibly can, you can then play around with volume. So I want you again to have a nice breath into your belly and start with a quiet s and making it louder. So something like this. And think about, what is that hand on your stomach doing? So have a try at that one. Once you've practiced a couple of times producing these sounds, that's when you should have the skills to practice this in conversation. And I'm going to give you 30 seconds now to maybe practice with the person sat next to you, or if you're in a room on your own, just practice saying something. What we're aiming for is to take that nice deep breath in, and on the out breath, you will say something. So I'm going to take a breath in. My name is Louise. I am a speech and language therapist. So we're using all that breath that we've inhaled into our lungs to be able to produce a nice, clear, relaxed sentence. So I'll just give you 30 seconds now just to practice that amongst you. All right, so it's that breath that you want to be using on these different platforms. That's what's going to support the vibration of your vocal cords and reduce any tension in your larynx or in the muscles in your throat. Over to you.
So one really quick exercise that I love to do between patients, if my voice is feeling a little tired, or maybe I ate some really tomato-based acidic lunch and I'm kind of feeling a bit mucusy, or like my vocal cords just aren't vibrating as they usually do, I love this little exercise. So I'm going to teach it to you now, and I really hope that you try it because it's fun, even though it's weird. So it's called a lip trill. You can also do a tongue trill. It doesn't require any tools. You just need yourself in about 30 seconds. So when you feel like that was a really rough session with a patient who just wasn't hearing me, and I feel like I was just straining and I just need to reset myself, reset my voice. Maybe you've already done some good head and neck stretches that you already know because you're physios. And you just need that extra little bit to get the voice to settle down and reset, a little massage for the vocal cords. All you're going to do is blow air through your lips and let them kind of tremble and vibrate while making sound. So it's going to look like this. For some people, doing a tongue trill is easier. You're just playing around with different pitches. Your body is not able to do this if you have tension at all in this area. So it's a really good indicator if you're really struggling to do that exercise. It's probably because you're not relaxing everything, and we want everything to be relaxed, especially the base of the tongue. So take a second, put your videos on if you're brave enough, and give it a try. So let's just try making a real quick, see if you can pull it off, or a, see if you're able to do it. For some, this will come easily, and for some of you, it's gonna feel really difficult. And if it does feel really difficult and it's not coming to you, don't worry, I have a good exercise for you too. So I'm just gonna give you 30 seconds to give it a try. So this is something really simple. Sometimes right before I get on the phone, I'll just quickly, I know my voice isn't sounding great for whatever reason, I'll just do a quick. Hi, this is Andrea with speech therapy. So it's super simple, and I swear it works. You've probably seen singers, or if you are a singer, or actors kind of do these weird vocal warm-ups. They are weird, but they do work. So if you have any questions about that after, let me know. Let's move on to the next one. I hope you tried it. Okay, so if that was really tricky for you, or you just felt really uncomfortable with it, we can do tube resistance. I love this exercise. It's such a quick fix. It will rid of tension very quickly, but it does take longer. It takes about 3 minutes to work, and it also requires a straw and some water. So you probably can't try this one right now because you don't have the tools, but it's really quite simple, so I don't think you'll struggle with it. So you're going to take a straw and you're going to put it about 1 inch in some water, and you're going to make a nice seal around the straw. So jaw is nice and relaxed. It's not overly open, or it's not clenched. It's just nice and relaxed. And you are going to make sound and blow bubbles at the same time. And then sing your favorite song, whatever that is. I'm going to do Happy Birthday. That's not my favorite song, but it's easy. So let's do. And you're going to have to do this for about 3 to 5 minutes to really feel the effects. The further the straw is in the water, the more difficult the exercise is going to become. And the closer it is to the top, the easier it is. The way this exercise works, and the one I just showed you prior, they both have very similar concepts, is one, you're reminding your brain how to speak without tension. Because by blowing the bubbles or making the lips and tongue trill, You're having to use that good breath support. You're having to make sound on that exhale. And when your brain feels how good that feels to make sound just using air, other than squeezing it really tight, it likes it and it wants to carry on doing it that way. But you kind of have to keep giving your brain those indicators and those reminders. The other way it works is I'm blowing air into this cup, and some of it's coming out in bubbles, and some of it's going back through the straw, back through my vocal tract, and into my larynx, and applying some pressure onto those surrounding muscles, those false vocal folds. And it's making them kind of just want to relax. So again, it's like a little bit of a massage. We can't get in there and digitally make your false vocal folds stop being used. So that's why this is such an awesome trick, because that extra added air pressure back into your throat helps those muscles just want to do this. And sometimes that's what you need after a patient. I also find that this exercise is really relaxing. So I understand maybe you can't do this in every scenario. Maybe you can't do this between every patient, but I do keep some plastic straws here that I have left over. If you're physios and you're just next door, come let me know and I'll give you one if you're feeling like your voice is just really tight. And just do that quick, easy 3 to 5 minute exercise, and you can just start your day again with a better voice. So you're not kind of continuing to add to that tension to the point where you come out with vocal nodules or a polyp or muscle tension dysphonia. We don't want any of you guys going down that route. Back to you, Louise.
So we have finished with the practical element of the exercises now, and we just wanted to talk a little bit more about trying to be understood through your mask. So we know that wearing a mask removes all that visual information during the communication. And again, that can make us push or strain our voice to try and make ourselves heard. So we thought we'd just think about some tips to make you be understood when you're wearing your mask. So think about the patient. I mean, are they wearing hearing aids? Are they in place and are they working? Think about using clear speech and trying to speak a little bit slower so that everything's a bit clearer. Also find out from the patient, how do they prefer to communicate? Would they prefer that you write down the information rather than try and speak through your mask? Have that conversation with them before you start. And you can also appeal to other senses that are intact, for example, touch or gesture. That can be really, really useful when you're trying to communicate. I appreciate that trying to reduce background noise can be incredibly difficult during in a hospital setting, but perhaps if you know that you're going to be having a long conversation with your patient in the mask, you could perhaps take them to a family room or somewhere that's slightly quieter, where you are not needing to raise your voice or strain your voice. And then finally, I know from personal experience that wearing a mask for long periods can be incredibly hot and incredibly drying for your mouth and for your throat. So it comes back to that hydration. Make sure you're well hydrated before you're wearing your mask for long periods. Again, it might be useful that you do some steaming in the morning before your shifts, and make sure when you're coming off your, taking the mask off for your breaks, maybe that you're not always reaching for the caffeine, but you are having a nice drink of water to sort of lubricate the muscles to optimize your voice. So I'm just going to hand back to Andrea now, who's going to talk about how we screen patients for voice following and airway disorders.
Great, thanks, Louise. So I'm going to try and speed through this a little bit, just so we have time. I saw you guys have some questions, just so we have time at the end to answer some of those great questions you guys have. But making sure you, after thinking about taking care of yourself, I know you guys are always looking out for your patients, so we're going to transition to how to look out for them as well, in regards to, like Louise said, their voice, their airway, and their swallow. So many of you are seeing patients who are post-coronavirus. So maybe they were intubated for an extended period of time, or just intubated for a normal period of time. Maybe they have a tracheostomy tube. So what can you screen for to see, did they have any trauma as a result of that? It's very common, especially with an emergency intubation or for an extended period of time of intubation, for people to have resulting laryngeal trauma, like one of the vocal cords becoming paralyzed. So instead of them both coming together to talk and vibrate, maybe only one of them is doing all the movement. In that case, they might sound really breathy when they're speaking. Or you might find that they also are having issues swallowing because of that, but I don't want to jump ahead. So what can you look for in regards to voice complications? Is their voice hoarse? Do they just sound weird? Is it really gravelly and kind of just like they can't seem to speak correctly and you can't understand them? Is it like that? Is it really breathy like I talked about earlier? Are they unable to control the pitch of their voice? Can you not hear them at all? Do they have no volume? If you're noticing any of those things, that would be something that you would want to flag. Let's go to the next slide. So also swallowing complications. So same of paralyzed vocal fold, as I said, could also cause swallowing complications because the patient's not able to protect their airway. Also, they might have some sensory impairment from being intubated. So maybe they can't feel when water is hitting them going down the wrong way. So maybe they're more likely to not be able to catch it in time, and then it's too late. So what can you notice? Well, maybe during the session, if they're taking a drink of water and this is happening, if they're doing that every time, I actually did choke my water. If they're doing that every single time they take a sip of water, that's an indication that something's not right there. If they're complaining that they're having trouble eating or drinking normally, if they are complaining that they've had a chest infection, that would be an indicator of, ooh, I wonder if they've been aspirating and that's why they've got a chest infection. So these are all things that you would want to flag. Sorry, let's go to the next one. And then airway complications. So this is in the absence of maybe having asthma or COPD. But if you're noticing that your patient maybe has this weird unproductive cough, so they're not necessarily bringing anything up, and there's no reason for their cough, but they keep kind of frequently throughout your session, and you ask, oh, are you not feeling well? Do you have allergies? And they're like, no, I just have this really irritating cough, this weird tickle in my throat. That could be a result of having had coronavirus, because long-term respiratory infections like that can cause long-term tracheal and laryngeal mucosal and epithelial changes, and it can also become more sensitive. So your patients might be experiencing this want to kind of constantly clear their throat or cough. And that's something that we can treat in speech therapy. So being aware of that. If you notice that they've got some stridor when they're breathing, if they sound like that when they're breathing, maybe not so severely. Again, another indicator that maybe they've got something going on, and that's something that we as speech therapists can treat. So we'll go to the next slide. So how else can you kind of screen these things with your patients if it's not overly obvious for you? You can ask them these questions. Have you or your family noticed any changes to your voice? Do you have difficulty being heard, altered quality of voice, your voice becoming tired by the end of the day, or inability to alter the pitch of your voice? Are you having difficulties eating, drinking, swallowing? Are you coughing, choking, or avoiding any food or drink? Have you developed any changes in the sensitivity of your throat, such as troublesome cough, throat clear, throat tightness, feeling of the throat closing off, difficulty breathing, or noisy breathing? So if your patients answer yes to any of these questions, definitely flag us, and I'm going to tell you how to do that in the next slide. So I've been tailoring this a lot to those of you who are seeing patients virtually, but I know some of you guys are in inpatient, and I apologize for that. If you're on the wards and you've got a patient that you feel like SLT would benefit from SLT, first just go ahead and refer them to ENT. That's usually quite easy. They'll see them pretty quickly, and then they'll get us on board as well. They'll send that referral to us if they think, oh yeah, this is definitely something SLT can handle. If you're outpatient, it's a bit trickier. So I think the best way to handle it is to contact us, SLTs, and we'll kind of discuss it with you and then figure out what the best route is, whether to first go to the GP and then have the GP refer to the ENT, or whether we can kind of sneak that referral in to our ENTs, because sometimes we are able to do that ourselves and it might speed up the process. So I think for outpatients, if you've got a patient that you have a query about, contact us first, we'll discuss it and we'll figure out how to make that referral happen quickly. And this is our emails here on the next slide. And we'll be happy to give those to you as well. I'm sure not everyone, you guys are not able to just quickly copy that down, but you can also find us within the NHS. But those are our emails. And I think that's the last slide. I think now we can answer some questions. Yeah, so some of you guys had some really good questions.
So I'm just going to stop sharing my screen so I can have a little look at those as well.
So Laura asked, in your opinion, what's the longest period of time that you should keep talking? I personally think give yourself 45 minutes of, if you're going to be talking for about 45 minutes, I think that is the longest you should kind of go with continued talking. I think then give yourself a little bit of a break. Let your voice rest a second. How many hours of virtual sessions with patients should we do in a 7.5-hour day? I think that's really going to vary from person to person. Ideally, maybe 5 sessions, if they're all about 45 to 60 minutes. I mean, ideally they're 45 minutes, but maybe you don't have control over that. But I think it depends on who you are. So if you're someone right now that you're like, ooh, I'm still kind of struggling with my voice, I haven't mastered that ability to just relax and just speak to my patients, I'm still kind of straining and it's requiring a lot of thought for me to just easily produce voice. If you know you're kind of in the habit of still projecting, and even with the tips, you're kind of struggling a bit, for you, maybe take that number down a little bit. Maybe see less patients than that. If you feel like, okay, you know what, I can, I'm doing a pretty good job of speaking on the exhale. I'm feeling like it's easy to speak even at the end of the day. I think I'd be okay with seeing maybe 5 sessions today. Great. But again, tailor it, listen to your body. If you're finding, ooh, I'm really, after lunch, I've just got nothing left. One, let's have a chat and let's work on making sure that you're using a better voice for that first half of the day. Let's do those exercises in between, do your vocal hygiene, and maybe let's work you up. It's just like any other muscle. So if a singer hasn't sang in a year and then they go on American Idol and try to bust out this amazing opera, it's probably not going to be great. Their body's not going to be in shape for it. So you also kind of have to allow your body physiologically to get in shape for doing what you're doing. I hope that answers your question. It's a bit vague, I'm sorry. Louise, is there any other questions that I missed that you wanted to answer?
I'm struggling to see them, actually.
Oh,
sorry.
Oh, it looks like one more. It says, breath work is becoming more and more popular for stress and mindfulness. Is this also beneficial for our voice? Yes, absolutely. Especially if it's learning how to use diaphragmatic breathing. It activates those lower lobes of your lungs, which also activates also calms the nervous system, which is great. The calmer you are during a session and the nicer voice that you're using during a session, the more you're going to be able to keep that voice going without having trouble. But what I would say is if you are doing breath work, practice what Louise taught us earlier. Practice taking that breath in, doing that nice diaphragmatic breath. Hi, how are you? Kind of like yawn it out. See if you're even able to just do that much. Hi. Okay, ooh, I was able to exhale and say hi. Let me see if I can make it sound a little bit more normal. Hi, how are you? Ooh, okay, yeah, I can. And play around with it. So rather than just doing the breathing, see if you can make that connection between breath and production of voice. So as you're exhaling, also activating the voice, also trying to phonate and see, ooh, can I do those simultaneously? A lot of us never really thought about our voice and suddenly we had to. So it can sometimes feel a bit weird and unusual.
I can see one other question actually now. How do people lose their voice? So I think there's multiple reasons why people lose their voice. If we're thinking about vocal hygiene, it might be that you're dehydrated or the vocal cords have become, dehydrated and therefore they're not able to vibrate as much as they once were able to. Things like smoking, that can inflame the vocal cords, which again affects the vibration. And reflux, additionally, that can make the vocal cords quite swollen, and again, they won't move as freely as they should be. Then thinking about tension, and hopefully you can remember back to that picture that Andrea showed you of those vocal cords that were really, really tense. What's happening there is there's a gap in the vocal cords, which is allowing lots of air to pass through, and that can really affect the sound and the quality of the voice. And over time, if there's too much tension, or we're squeezing or straining the voice, patients can develop nodules or polyps, and again, that can really impact the sound of the voice because they get in the way of the closure of the vocal cords. So that could be another reason why people are losing their voice. I can't see any other questions.
Any link with allergies, pollution, hay fever, and voice issues? Yeah, absolutely. If you've got bad allergies and your symptoms are that you have to cough more often, or you feel that tickle in your throat, or your throat can feel really dry, yeah, that can definitely affect your voice, because as Louise kind of mentioned earlier, every time you cough, you're slamming those vocal cords together. So if you're coughing all the time throughout the day, those vocal cords can become really inflamed. I mean, they're very vulnerable tissue. They're not like the skin on our arm. So, I mean, imagine if you were just doing this to your arm several times a day, you'd probably have a big red mark, and it wouldn't be great. Think of it the same way with your vocal cords, except for less, because you don't have that nice protection. And you're slamming them together, they're going to get red, irritated, inflamed. And when they're inflamed, you kind of saw in that picture of the gentleman with the strain, when part of your vocal cord is fatter or more inflamed than another part, that's how you get those kind of gaps when you're trying to close off and start that vibration. When you have a gap, that extra air escapes, and when you vibrate, only the inflamed part touches. And that's when you start getting this weird sound or hoarse voice. And then for some people, maybe they lose their voice because it just won't vibrate at all. So what I would say is, if you have bad allergies, try to manage them best you can, and try to avoid coughing best you can. Instead, just try and take a sip of water, try and breathe through it. Of course, sometimes we have to cough. We have to get whatever that particle is out, and that's fine too. But yeah, definitely can be a link between the two. Any other questions, guys? We've got about 10 more minutes. So if there was any questions that you had, I feel like I might have sped through that last bit thinking we were running out of time. But if anything wasn't clear throughout the presentation and you want to ask Louise and I, we would be happy to talk about it or chat about it with you. So let us know. Cool.
Okay, it's looking quiet, so I think we'll end it there.
Cool. Thank you so much, guys. I hope you guys found it useful, and feel free to email us with questions.
Can I just say thank you so much to you both? I never knew there was so much about a voice. It was really, really interesting, and yeah, I'll take on board everything that you've said and get in touch if we've got any questions. But thank you very much indeed. It was great.
Thanks for inviting us to chat to you all.
Yeah. All right, thanks, guys. Good luck. Take care of your voices.
Bye.
Bye.